humility, meekness, and patience. Bear with one another, and if anyone has a complaint against another, forgive each other, just as the Lord has forgiven you. In Ecclesiastes yesterday, the writer speaks of life as an unhappy business. He had found most human-oriented pastimes to be a waste of time. He had lived a life of pleasure only, then went looking for laughs but found no lasting satisfaction. Next, he had thrown himself into work, building houses, growing crops, creating gardens with pools and fruit trees, but still felt empty. He had had many women, looking for answers in promiscuous living, amassed a great wealth, and was pleased with his success, until he realized that someone else would inherit it all and very likely squander it. Our Lord Jesus Christ makes the distinction between living only for this world and having an eternal perspective, when death cancels out material possessions. God says to the rich man, this very night your life is being demanded of you, and the things that you have prepared, whose will they be? So it is with those who store up treasures for themselves and not rich towards God. He said to his disciples, therefore I tell you, do not worry about your life, what you will eat, or about your body, what you will wear. For life is more than food, and the body more than clothing. True wisdom lies in the desire to love, serve, and please God. The life King Solomon described cannot be compared to living as one made in the image of our Creator. Our new self gives us identity, direction, and purpose. True wealth is found in living a godly life, the scriptures for this morning. These lead us to discover our self-worth rather than measuring our value with the possession of material things. Forbearing, forgiving, loving, peaceful, harmonious, grateful service, lifted praise to God. These are the characteristics of a life that has eternal value. If everything you do is for the sake of God and to the glory of God, it brings an indescribable joy. You leave a legacy of love. There is no living in vain when you live for the Lord. Let us pray. Our Father, thy kingdom come. Give us this day our daily bread. Forgive us our trespasses, as we forgive those who trespass against us. Not into temptation, but deliver us from evil. For thine is the kingdom, power, and glory, forever.
Good morning, honorable members. When the business of this House suspended last evening, the honorable member for Elizabeth had reserved the floor. The chair now recognizes the honorable member for Elizabeth.
Thank you, Mr. Speaker. Today, I rise on behalf of the great people of the constituency of Elizabeth. 10 years ago, my relationship with them started, and I tell you it's difficult to believe that we have come this far. 2 years ago, May 2017, the people expressed their confidence in me, not as a lone candidate, but as a part of a team to tackle the big problems, to address the root causes of the problems facing our country. We all signed up for an assignment that we knew would not be easy, or simple, or quick. As a matter of fact, we recognized that no single individual working alone could or would turn around the drifting ship of state, not even the most progressive leader. But together as a team, guided by our leader, we knew that we could move mountains. And so, Mr. Speaker, I'm proud to be a part of, and I want to publicly recognize and thank the team of committed, patriotic, passionate Bahamians who have welcomed me into this fold, led by the members for Kalani and East Grand Bahama. In this place, we started at 35, and for the most part, give or take, we have managed to remain mostly intact. I have learned to see and respect their individualism, their style, their courage, their energy, and their passion. There's talent and abundance on this team, Mr. Speaker. I mean, how can you duplicate a full-brim wearing, straight-talking member from Bangor? Or a fired up and ready to go Baines and Grandstown? There are few people with hearts as big as the lady from West Grand Bahama and Bimini, the twins from Eleuthera, and the member from North Andros. They got their island on lock. I defy you or anyone to show me a member more positively animated than Freetown when he's on a roll. You see, the last 2 years have taught me a lot about perseverance, hard work, and steadfast discipline. So as I stand here today to offer Elizabeth's full-throated support for this budget and the accompanying legislation, I shall attempt to add some perspective. Perspective gained in attempting not the simple or the mundane, not just paying lip service and pandering to earn political points, not releasing comments for effect, like balloons into the stratosphere, then claiming that they were safe, the biodegradable kind, but genuinely playing my role as a part of a team to turn this country around. This team, led by the member of Kalani, has willingly and deliberately waded into the swamp, not to wallow in the swamp, not to fight alligators, but to drain the swamp. Our mission has been about transformational change. Help me, South Beach. Transfigurational change. This journey has been about careful characterization of all that is right about this great country and seeking to make those things better. But it's also about identifying and acknowledging the things that we can do better and not running away from them, but tackling them head on while engaging the people impacted. These are our people, and we must engage them in dialogue and debate. You see, we are attempting to change the lives of the people and the children of this great country.
Yes, sir.
Amidst the noise, the prevarication, the obfuscation, it sometimes becomes difficult to focus on, as Martin Luther King said in Montgomery, life's most persistent and urgent question. And that is, what are you doing for others? Now, since the last debate on the budget, much has changed. My third child, Nicholas, has completed high school, and he's preparing for college. Child number 5, Amadeus, has graduated from primary school, and he's moving up to the big leagues in September. One of my biggest fans, constructive critic, ardent supporter, and chief counselor, my dad, is no longer here to offer his wisdom. And the entire Bahamas seems to have struck up a love affair with marijuana, but we'll talk more about that later. You see, Mr. Speaker, it is the people of Elizabeth who have sent me to this place. It is their encouragement and support, advice, and direction that sustains my efforts. I have an awesome executive team led by an awesome chairperson who has stood with me in good times and in bad, and I cannot thank them enough. Over this last year, we were pleased to host our extended after-school program for BJC and BGCSE preparation. And this program is oversubscribed with students. Month after month, the children engage from all over Elizabeth and indeed much of New Providence. Using our constituency allowance, we have refurbished almost every park throughout the constituency, repairing rutted benches and rusted play sets. We've restored neglected swings and community signs. We've installed walking paths and attractive gazebos. Throughout the constituency, we have focused on making the community more attractive and more conducive to the enjoyment of the great outdoors. We remain Elizabeth strong. Now, Mr. Speaker, I continue to hear the concerns of patients, colleagues, students, and staff as I have left the practice of medicine. I have now reduced my clinical activity to less than 1 day per month at the Rand Memorial Hospital performing public dialysis access cases. As you know, there are no vascular surgeons in Grand Bahama, and these patients would otherwise have had to have been transferred to New Providence for surgery. The approach of having them stay in Grand Bahama reduces overcrowding at PMH and drastically reduces costs and waiting times for patients. About 4 times over the last year, I have been summoned to assist in the operating rooms in Nassau, again at no charge, by my colleagues who are dealing with life-threatening clinical problems or covering clinical problems when there was no suitable specialist in town. In one instance that I'll tell, the chief of surgery at PMH requested my assistance in controlling a ruptured aneurysm of a young lady who was in shock on the operating room table. He was having difficulty controlling the bleeding and feared that she might bleed out and die on the table. My senior colleague called me. I went. It was as simple as that. I was happy to assist, Mr. Speaker. Together we got control of the bleeding, got her out of the operating room, alive. Critical, but alive. I am pleased to report that she made a full recovery and was discharged home. Such is the nature of our small country with limited human resources. Let me stop and thank Dr. Paul Ramphal and the other surgeons who have continued to step up in my absence. Recruiting replacement specialist surgeons is neither easy nor inexpensive, and the efforts of my colleagues have been yeomanlike. It is good to report that Dr. Amal Higgins, a Bahamian vascular surgeon living in Orlando, has started periodic visits to Grand Bahama. So he and I now share the load that I once carried alone. I continue to encourage Bahamian practitioners, and in particular Bahamian specialists, to return home. We now have a visiting cardiac surgeon who began operating in the Bahamas 2 days ago. We are in the process of recruiting another full-time vascular surgeon, and we shall actively seek a surgeon with kidney transplantation skills to further the evolution of our program for the management of kidney failure. Now, Mr. Speaker, I am indeed privileged to have been asked by Dr. the Most Honorable Hubert Minnis to serve as the Minister of Health in his cabinet with responsibility for the Ministry of Health, the Department of Public Health, Public Hospitals Authority, and the NHI Authority. We're now 2 years into our term of office, and I'd like to give a report on our progress thus far. But before I do that, I wish to give a heartfelt thank you to my team at the Ministry of Health and the various agencies, commissions, authorities, and boards. Our staff has been absolutely amazing, and though the minister may sometimes appear as the face of the ministry, I can assure you that it is the committed people around me who are the real heroes. This year, the people of the Bahamas will entrust the sum of $301,973,000 and some of their tax dollars to the public health sector. $223 million of this will go to the Public Hospitals Authority. $58 million is allocated to the Ministry of Health, and we have provided $20 million for the continuous operation of the NHI Authority. We have also been allocated $12 million for capital projects. Some have asked whether I, as minister, whether I am happy with this allocation. Okay. Now, Mr. Speaker, political commitment to improve the population's health without the attending funding and action is meaningless. The health budget for fiscal year 2019-2020 represents the government's commitment to saving lives, to enhancing the quality of lives lived, improving our national productivity potential, safeguarding our people, our prospects, and our progress. As such, 12% of the government's recurrent budget has been allocated to my ministry. And when we add the $70 million spent on health insurance premiums, the total government spend on health in this fiscal year is 14.7% of total government spending. Now, just for sake of comparison, around the world, according to the WHO, governments spend in U.S. dollars about $60 per person on health in lower middle income countries, and close to $270 per person in upper middle income countries. Mr. Speaker, based on the allocation for the next year's budget, this government will be spending $978 per capita. So we are punching above our weight, and we are investing in our people. This level of government health expenditure is typical of high-income countries. This total is more than any other government sector and comparable to the investment in education, $350 million. If we look at total spend on health, at about 9.7% of GDP in 2013, or $800 million, the Bahamas' total health expenditure ranks among the top 5 in Latin America. I'm not talking about just per capita, I'm talking about total spend. Furthermore, the total health expenditure as a percentage of GDP has been climbing over the last 2 decades. By comparison, the U.S. spends 17.8% of their GDP on health, and the OECD average in 2016 was 11.1%. Now, with the current trends in non-communicable diseases, violence, and infectious disease, particularly HIV/AIDS, it might be easy to suggest that we should spend even more. Ours is an island nation, a group of islands, rocks and keys separated by water not just between but within. And this reality, combined with the ongoing consequences of climate change, might suggest that we should borrow a few million or a few hundred million to bridge the gap to get from where we are to where we want to go. And this approach has been adopted in large part because there has been a political strategy to promise healthcare services as free services. You see, every year for the last 20 years or more, we have shifted funds from wherever we could find them, from the NIV fund to build clinics and health facilities, even as the NIV fund has been depleted. We have also borrowed and used deficit spending to finance essential services like education and healthcare. And while we have even passed legislation that outlined nominal contributions to health services, I'm referring to the Health Services Act, there has been a politically mediated evolution to have fewer and fewer persons contribute even the smallest amount for their health services. Even as we recognize that the public purse was increasingly unable to afford the services promised or even the services required by mandate. What started as a genuine safety net for the most vulnerable among us, a safety net that we must and we shall preserve, evolved into a system of patronage. At the least, it avoided the difficult, the awkward conversations about choices, personal responsibility, and limits. Much of the anguish and the angst, the grief, the stress, and the aggravation has been transferred from the consuming public to the long-suffering staff who have carried the public health system through sacrificial service, most of the time on their backs. Now, this strategy worked for decades, as there was often just enough to keep the system together. When it didn't work, successive administrations have avoided the controversial decision to insist on maintaining the obligatory partnership with the community. And instead, the monies were found somewhere, and they were gifted to the people, sometimes with an expectation that the people would then show appreciation and support. This strategy has been used annually in the Bahamas since 1973, and we have now accumulated mountains of debt. So much debt that next year we will spend $362 million, almost the same amount as the total healthcare spend, or 14.5% of our budget on bank interest alone. Now imagine the new equipment, the clinics, the schools, the hospitals, the roads that could be built if we had that $362 million to spend each year for capital projects or even scholarships. There must be a different approach, Mr. Speaker. As much as there are needs, as much as there are deficits, notwithstanding our challenges, it is clear that traditional approaches of borrowing to augment expenditure is a defeating strategy.
Absolutely, my friend. Absolutely. Absolutely.
And while I don't intend to discuss the merits of expansionary fiscal policy, which I know a little something about, and the view that it boosts economic growth in the short term, at some point typically defined by debt to GDP, it becomes a slippery slope with diminishing returns.
Right.
I'm no economist, but slow growth of debt contributes to overall growth. But rapid growth of debt above 2 to 3%, or the deficit of 2 to 3% added per annum, if sustained, almost invariably will trigger a bust, as government spending squeezes out investment by the private sector and interest rates rise on sovereign debt. You add to that a few downgrades, or maybe 4 or 5, and that triggers more expensive bond interest rates, and the economic contraction results. It must be clear, therefore, Mr. Speaker, that ballooning debt is itself a malignant cancer that chokes out the life of every sovereign nation. But it ought to be clear, based on my premise, that our already struggling economy will by necessity be strangled, crippled by our health challenges, unless we can make some very real changes to fix some of the behaviors which allow us to prevent sickness in the first place. And so it is in this vein that the Ministry of Health has advocated a more fundamental approach to wellness and health. And we have tried to squeeze every drop of waste and inefficiency from our programs. And yes, we have taken an aggressive posture with regard to seeking legitimate, sensitive, socially responsible approaches to revenue. You see, Mr. Speaker, as a part of this government, we are committed to fundamental reform that Bahamians can see, that they can touch, and they can feel. Now, since taking office, we have defined the problem clearly and sometimes painfully. We've identified the challenges, the opportunities, the assets, and the liabilities. And I want to tell you the story of our current healthcare reality updated to 2018. In 2018, the life expectancy of a Bahamian citizen at birth was 75.7 years, 72 for males and 78 for women. Mr. Speaker, we are still one of the world leaders in penetrating trauma due to gunshots and stabbings. And the probability of males dying from these types of injuries far exceeds the risk of death from cancer or HIV/AIDS in the Bahamas. In 2012, the Bahamas had the 11th highest homicide rate worldwide. By 2018, murders had dropped to their lowest rate in 9 years, but still remains the greatest single cause of loss of productive life for males. It remains an unfortunate reality, Mr. Speaker, but for the last few years, the number one cause of death of a Bahamian male is a bullet. We are improving, but we're not yet doing well. Our infant mortality rates hovered between 18 and 23 per 1,000 live births over the last 4 years, among the highest rates in the non-Latin Caribbean. In 2016, however, when we had the latest data, it is now down to 16 deaths per 1,000 live births. By comparison, the infant mortality in the United States is 6 deaths per 1,000 live births. But, Mr. Speaker, of great concern, and we should all be concerned, is about overweight and obesity, which is extremely high in the Bahamas and worsening. The percentage of the population who was overweight reached 79.2% in 2012, up from 70% in 2005, with no statistically significant difference by sex. We expect new data next month when we get the results of our STEP survey, but I have no great optimism that this will improve. You see, 4 out of 5 of us, Mr. Speaker, including me, are overweight.
You?
And 49.2% are obese. For sake of comparison, 39% of the world's population were overweight in 2016, and only 13% were obese. Now, in a study of 2.8 million people, obesity was associated with what we call a hazard ratio of 1.18, which basically means that just by being obese, you have about a 20% chance, taking everything else being equal, of dying just because you're obese. All other things being equal, obese people also have a higher chance of getting cancer, endometrial cancer, breast cancer, colon cancer, kidney cancer, gallbladder cancer, and liver cancer. Also type 2 diabetes, renal failure, and stroke. So when we ask the question about the incidence of cancer in the Bahamas, understand that our rates are already skewed primarily because of our weight. Our risk factor profile and related complications for NCDs is not encouraging. 90% of us eat insufficient fruit and vegetables. 72.6% have adopted a sedentary lifestyle. 17% are current smokers. 41% are current alcohol users. 58.2% of us, more than half of us, have an abnormally high blood pressure. 24% or 92,000 of us have sugar, diabetes. We have 600 or more patients on hemodialysis at a total annual cost of about $25 million. And on average, we amputate 75 lower limbs every year because of diabetes. These lifestyle-related issues mean that Bahamians are on average sicker than most, require more health care services than most, die prematurely as compared to most, and have health care costs that are more expensive. And we also don't live in a single landmass where services can be consolidated. So consequently, our health care needs outstrip our financial capacity to pay. And the finance gap has to come from somewhere. So let me be clear. This is not about body shaming or simply about personal choices of aesthetics. We are paying an incredible toll because of our lifestyle choices. And that toll is paid not just in healthcare costs, but in a mounting pile of dead and dying Bahamians. Simply put, our lifestyle choices are killing us. Now, as a policy decision, I have agreed that there are to be no new categories of taxes this year. But the national budget is definitely not completely elastic. And so we are going to ramp up our educational campaign in order to modify behavior. This is war, Mr. Speaker. We have unwittingly embraced the enemy like a Trojan horse, the law of pleasure. The old people say, if you like it, let it kill you. And that has been to our detriment. So we are going to war with NCDs. Simultaneously, we shall thoroughly determine the potential impact of deliberate fiscal disincentives for unhealthy behaviors. So yes, the Ministry of Health has been considering the evidence supporting recommendations for sin taxes on sugar, alcohol, tobacco, and other vices. And while none of these taxes are yet ready to be implemented, this ministry will aggressively study the world's experience for an evidence-based recommendation to my cabinet colleagues. There are advocates today who believe that this will not only curb consumption, but in a way that also generates revenue to address the challenges brought on by unhealthy consumption.
Right.
We have also therefore embarked on an aggressive wellness initiative. We have been actively engaged in promoting healthier eating and the embrace of more physical activity. The entire Caribbean, led by Jamaica, has endorsed the concept of what is called Caribbean Moves. This started off as Jamaica Moves, and we will soon see Bahamas Moves. Now, in the years gone by, health and health-related matters were not considered sexy, nor were they hotly debated in the public space, until, of course, there was no health, or individual or collective health was being threatened. But times have changed, and now health is very much on the agenda. Our context is a shared one. Whether you were born in 1920s or you will be born in 2020, on this side of the political divide or on that side, whether you're a Baintown boy or a Great Inaugural girl, regardless of your means, level of education, or any other social economic markers. The defining characteristic of this context is a public purse that does not possess the property of limitless elasticity. In other words, it's only so much money.
Yes, sir.
As such, realities across all ministries, institutions, and departments ought to be framed within this context. We recognize that demand is great. It's almost infinite. We acknowledge the challenges of our healthcare system, and we have been brutally honest in our efforts to expose them. But we are resolute, Mr. Speaker, in systematically, methodically, deliberately, and definitively solving the problems one at a time.
Yes. Yes,
You see, I believe we're doing important work on behalf of the Bahamian people. Indeed, there can be no greater vocation than dealing with the lives of people. And so, yes, we're going to stay on the wall. The difficult we do right away, the impossible may take us a few minutes longer. Mr. Speaker, sentiments uttered by the Honorable Member for East Grand Bahama are worthy of echoing here. The increasing disparity between the needs of our nation and the resources available to meet them demands action and reaction. For health, the imperative in these lean times calls for disruptive innovation, streamlined operations, and it necessitates that we make some tough decisions, because we have to do more with less, and that is sometimes an elusive phantom. Even in these lean times, we have to ensure adequate investments in health. A healthy economy is fruitless and not achievable without a healthy population. So we must be jealous guardians of our health first and foremost. Given the topic of the time, Mr. Speaker, I want to talk now about marijuana.
Oh, yes.
There's been a whole lot of discussion in the Bahamas about the changes in the global perception of the plant known as marijuana, hemp, or cannabis. Opinions range from the view that we are rushing into hell on one extreme to the view that we are being left way behind. We accept that the world has changed. We accept that social views and legal approaches to the medicinal and recreational use of this drug or plant is in evolution. If we just look at the United States, medical marijuana is now legal in 31 states, and recreational use is legal in 9 states. 2 countries in the world have legalized recreational and medicinal use. That's Uruguay and Canada. So yes, here there's been a tremendous discussion. As these policies have evolved, there's been an explosion in the cultivation, processing, purification, commercialization of products from the plant. As a member of CARICOM, we agreed to be guided by CARICOM. And so the government of the Bahamas impaneled a marijuana commission to examine the views of Bahamians towards marijuana and to make recommendations to the cabinet for reform. That panel is chaired by Simeon Hall and Quinn McCartney, and they've been working for 3 months, but their work is not yet done. But in the Bahamas, CBD in particular has become the hot new drug. People want to eat it, drink it, smoke it, put it on their skin, put it on their hair. Despite the reality of the existing legal framework, many have chosen to ignore the laws of the Bahamas, and they have begun the commercialization of these products. Some have emphatically stated, Mr. Speaker, that legal reform elsewhere ought to be adopted here immediately, and that our existing outdated legislation is to be ignored. Some have suggested that the Marijuana Commission should not delay the progress, and I put progress in inverted commas, that would come with the embrace of cannabis. Simultaneously, there's been an increased appetite for the use of products made from hemp. Hemp milk and other edibles have been made available, and some people use them. Our laws, and you can say unfortunately, define these products as illegal. Whether they should be or should not be is not the issue. What is the issue is that we have not completed deliberations. Now, having impaneled the Marijuana Commission, I say again that we are not minded to circumvent their work by the issuance of multiple licenses. But just this week, I was served with a notice of a group intending to sue me as minister to force the liberalization of the existing legislation to allow for recreational use of marijuana. Now, I support this approach. I support all legal, civil, and other methods that advocate for change. It is possible that the Commission may recommend changes in the classification of plants from this family, and it is possible that we may adjust the legal framework. But until the Cabinet of the Bahamas has considered the recommendations and opinions of the public and considered the advice of the Commission, we continue with the laws as they exist. This is how democracies work, Mr. Speaker. In the meantime, the Marijuana Commission has asked for a 3-month extension. During this time, they'll establish a website. They will create a social media platform. They will conduct a comprehensive and widespread national survey, and they will meet with stakeholders. Now, of the full allocation, $2.27 million in new spending has been directed to the Ministry of Health's core functioning. And while it may not appear that this is nearly enough to bridge the gap between what is needed or what is demanded and what the collective purse can afford, I can assure you that we are going to use these funds judiciously. We're going to spend $1 million for the National Health Authority functions of health system monitoring, health promotion, and security, inclusive of some 15 national programs. We're going to apply $1 million to the operations of the Abaco and Exuma mini hospitals, $100,000 for emergency room operations, and $170,000 for midwifery training programs. Now, Mr. Speaker, I wish to now speak about communicable diseases, surveillance, and immunization. Infectious diseases with pandemic potential like influenza, Zika, chikungunya, and dengue, as well as the pestilence and vectors that carry them, are no respecters of persons or countries. Our health system must remain alert and responsive to ensure that the population's protection is protected from these and other emerging threats. Now, regional eradication of smallpox was achieved in 1971, polio in 1994, rubella and congenital rubella in 2015, along with measles in that same year. But around the world, we are seeing the re-emergence of indigenous measles in the United Kingdom, the United States, Venezuela, and other countries. And in 2019, the Bahamas have 2 imported cases of measles from Europe. This signals that for those of us in the Bahamas, we live in a moment of danger, that our global, regional, and national gains are fragile, and that our borders and shores continue to face and be susceptible to countless public health threats, including those like measles that can be easily prevented through vaccination. And therefore, we cannot neglect public health preparedness and response, as our economic health is invariably linked to this vital responsibility of the Ministry of Health. As alluded to earlier regarding our health, it is a travesty that the importance of sustained, strong public health measures are not valued until they fail. And so, Mr. Speaker, within the 2019-2020 budget year, my ministry is committed to fortify our surveillance systems, ensuring that they are sufficiently alert and responsive for protecting our people's health from these and other emerging threats. These funds will touch and be felt through our relevant media presence, our steady provision of high-quality vaccines, combined with an aggressive catch-up campaign to reach 40,000 persons with MMR in our tourism, security sectors, and schools. We're going to deepen our competency in internal health regulation capacities. We're going to go around the country to ensure that we have an extended reach to have every Bahamian know their HIV status. and we're going to strengthen our national reference lab capacity, now on its 4th round of being internationally accredited. This is a proud demonstration of our pledge to excel. I want to talk now about HIV/AIDS. The guiding approach for HIV in 2020 is that the view that the Bahamas should once again lead the world as a key opinion leader. We played an integral role in the elimination of mother-to-child transmission, and we have internally set a target to become one of the first, if not the first country in the world to eliminate HIV by 2030. And so while we continue to make strides with HIV, as evidenced by expanded treatment coverage, we had 42% coverage in 2015 and up to 57% coverage by the end of 2017. We've also seen improved viral suppression rates. We've seen decreasing new infections from 792 in 1994 to 335 in 2008 to only 151 new cases in 2017. We've also seen a reduction in AIDS deaths. But we realize that sustained financing for prevention, diagnosis, and treatment is required if we hope to achieve the 90-90-90 targets to end the AIDS epidemic in the Bahamas and elsewhere by 2030. The current overarching strategies for the Bahamas are in line with the United Nations fast-track end of AIDS strategy. As mentioned, 90-90-90, so we want to know that 90% of all people living with AIDS or HIV have been diagnosed. 90% of those who are HIV positive are linked to care, and 90% of those who are on treatment have their viral expression suppressed. We aim to see a 75% reduction in new infections, Mr. Speaker. We want to get the number down to no more than 70. And for those people who are diagnosed as HIV positive, we would like to get it to below 10% for those who are both diagnosed with HIV, but who also have AIDS at the time in the first year of their diagnosis. We aim to see zero discrimination. And specifically, we intend to modernize our treatment programs by introducing newer, more effective, and better tolerated treatment and prevention strategies. Now, Mr. Speaker, I've just stood in this place this year and previously and described the gravity of our national non-communicable disease epidemic. Our systems, whether they're the health system, the financial system, social or other, continues to bow under the weight of this epidemic. Our people are dying of NCDs at a disproportionately high rate. Indeed, we have the dubious distinction of having, if not the worst, then certainly one of the worst health profiles of all the countries in the Americas.
Wow.
In large part because of our dietary choices, reluctance to embrace exercise, sexual practices, and tendencies toward violence. Now, curative posturing has not, is not, and will not work for us. A few short weeks, I led a delegation to the 72nd session of the World Health Assembly. And during the opening formalities, we were honored to hear Dr. Richard Horton, the editor of the respectable Lancet Journal. And his words then and now resonate when he said, "There is no commodity in the world more precious than health, as there's little beauty in disease, but deep inspiration and hope in health." But, Mr. Speaker, despite such a profound utterance, it is sobered by the reality that Bahamians are living more years in poorer health, in disease, disability, and diminished quality of life. Fact one, the average Bahamian will live until, on average, 74. Fact two, the last of those 10 years of life will be spent in poor and failing health that will place heavy demands on the individual, his or her support network, and the healthcare system, among others. You see, old habits die hard. And as I've said before, and I'll keep saying it, we continue to eat too much of the wrong things in the wrong quantities, and we exercise either too little or not at all. Our NCD epidemic will not be halted and reversed through lip service, and we're going to put our money where our mouth is. So to this end, this year, we're going to increase our allocation over the private fiscal year by 18%. And we have allocated $1.8 million for the implementation of targeted wellness initiatives, which will be monitored and evaluated for impact and value for money. We recognize that this is not enough, but we believe that we are going to extract the most value from these funds. Some of the things that we're going to do is to relaunch what we call the Cyclovia Initiative. What that is isolating areas so people can ride their bicycles on a weekend. We're going to quantify or describe the health and health challenges specific to the school-age system. We're going to determine health literacy baselines and improving on it through a multi-pronged approach, including season 2 of the groundbreaking, informative, and highly successful What You Cookin' Ministry of Health production. Lack of education or ignorance is the deadliest disease that we must unapologetically confront and defeat. Delaying momentum on health literacy undermines financial investments in disease prevention activities and delivery of health care, and this we can ill afford. We're going to have a greater digital presence in the public engagement with the health system. We're going to expand access to nutritional counseling and education at the primary care system. In the long run, we're going to be trapping our preventable blindness rates from diabetes and the need for dialysis. Now, Mr. Speaker, we're going to keep the corned beef, at least for now. However, as this new budget is heralded into effect, the Bahamian people will touch in their cupboards and feel in their wallets the work done over the last fiscal year to make healthier food options more affordable through a reimagined and less obesogenic breadbasket. So specifically, Bahamians can look forward to spinach, broccoli, romaine lettuce, apples, oranges, strawberries, beans, peas, almonds, and so much more, not only being VAT-free, but price control protected. Now, related to this issue, Mr. Speaker, my ministry is not satisfied to stop here. We have heard the noise in the market and identified with the cries across the length and breadth of the Bahamas that reduced duty or duty-free concessions on various food products and other items are not being transferred to the customer at the cash register.
Right.
And we will work with civil society, consumer protection, the grocers community, and others to ensure that this is remedied. As far as mental health, some of this $1.8 million will also impact areas, will also impact areas of my ministry's work related to mental health and violence. You see, mental health has been a stepchild in our national considerations for far too long. And my ministry this year will begin walking the road to right this wrong. What this means is that mental health services will be brought closer to the communities where people live through more coordinated mental health services with the hopes of dismantling decades of stigma and discrimination. Now, what I'm about to say may not sit well with some people,
Take your time, sir.
but be that as it may.
Get a drink quick.
The solution to violence and crime will not be found on East Street, Fox Hill, in these halls, or in the courts. Yes, these are necessary contributors. But for sustained decreases in homicides, rapes, intimate partner violence, and the like, we must explore the root causes of violence, considering traditional and non-traditional theories. And so in fiscal year 2019-2020, my ministry will direct resources to and confirm public-private collaborations for advancing our collective understanding on the impact of the nutrition on the expression of violence in our young men and women. Specifically, we will see how our food choices are contributing. Let me say that again. Specifically, we see how our food choices are contributing to what I call slow dietary suicide, manifest by obesity, hypertension, diabetes, and cancer. But it is also quite possible that the malnutrition of our people is also contributing to the high rate of homicide. And so, as we commit institutionalized suicide by diet, these same foods may contribute to the increased propensity to violence, because you are indeed what you eat. As for our legislative agenda, just briefly, we propose to have an amended Dental Act, Medical Act, Pharmacy Act, Mental Health Act, a single governance bill, tobacco control, to introduce for the first time a mortuary services bill, patients' right bill, an amended Public Hospitals Authority Act, an amended National Health Insurance Authority Act, and an amended Dangerous Drugs Act. I wholeheartedly believe that great risk is needed to achieve great victory. And I already indicated my ministry's intent to present a single governance bill. You see, in 1999, our health care services were split into two distinct arms: the Public Hospitals Authority for Acute Care and the Department of Public Health. We have to reflect on and learn from that moment of history, as this fragmentation has cost us immensely and immeasurably. So, Mr. Speaker, inherent in this right-shifting and re-amalgamation of hospitals and community clinics under a single governance structure, there may be ripe opportunities for improved efficiencies, greater accountability to the Bahamian people, and faster processing time for bringing on new qualified staff. I would be guilty of dereliction of my duty if I were not persistent in ringing the alarm and drawing attention to our human resources for health. There is no health, no universal health, without a health workforce. And this country, which is a giant on the world's map, remains highly vulnerable and continues to be disproportionately affected by health worker migration and mobility. Simply put, our nursing talent is being mercilessly ripped from the nationally available pool, with many migrating to more financially attractive markets and territories with offers of better working conditions, better job security, and higher salaries. From 2015 to date, this country has produced 308 registered nurses, an average of 62 nurses per year. But yet in 2018, the Bahamas recorded a nursing deficit of 528 nurses, a direct consequence of the poaching practices of other territories. The latest national data supports the assertion that the balance between nursing gains and losses is precarious at best. We now are at less than 27 registered nurses per 10,000 population. The Bahamas is well below the necessary nursing density, therefore, to support health reform, where you need 34 per 10,000, to achieve universal health coverage, where we need 44, or to eliminate preventable maternal deaths, where we need 60 per 10,000. But these chronic and critical shortages don't just apply to nurses. We need pharmacists, nutritionists, community health workers, and technicians for lab and diagnostic services in enough numbers of appropriate types. And so, in conjunction with the member for South Beach and the Minister for Education, we are going to be amending the approach to scholarships for aspiring Bahamians.
Yes.
And so no longer will scholarships be given only to a disproportionate number of people wanting to be medical doctors, thereby contributing to an unsustainable and unbalanced health reality. We will support fewer doctors, Mr. Speaker, but we are going to compensate by producing more allied health professionals.
Thank you very much. Thank you. Audiologists, radiologists, and technicians. Need them.
Now, in terms of our gains over the last few months, in April of 2019, we posted a position to Cat Island. In May of 2019, another to Exuma, bringing the total in Exuma to 4. By the end of June, a position will be posted to Cooperstown. By mid-July 2019, 3 positions will be posted to Marsh Harbor, bringing the total to 4 for that settlement. And by the end of the year, a position will be posted in Sandy Point. I don't hear anything more from Abaco. Hold on, I'm getting to you. By mid-August 2019, A position will be posted to Sam's Long Island. My colleague is not here from South and Central Andros, but I can assure that honorable member, if he is listening, that a posted position for the people of South Andros will be placed this fiscal year. In the meantime, we will continue to supply locum support. The last locum was supplied from the 1st of May to the 11th of June. In fiscal year 2019-2020, we're going to hire 40 doctors, 40 nurses, a health economist, an epidemiologist, 10 pharmacists, 7 laboratory technologists, 11 dentists. We have been charged to populate the mini hospital in Abaco and Exuma, and we intend to do exactly that. Mr. Speaker, I want to spend a little bit of time talking about nurses, who are a crucial, critical part and the largest part of the healthcare professionals. Evidence has shown that there's an association between the numbers and skill mix of nurses and health outcomes. And we have invested heavily in recruitment, salaries, benefits, education, and training of nurses. Based on an agreement that we have with the Bahamas Nurses Union Agreement, nurses will receive an increase of $1,200 added to their base salaries effective November 2018, and this payment should be made in June of 2019, and it is possible that we may hear more about attractive things to happen for nurses. Now, Mr. Speaker, while there is not a shortage, position distribution across critical areas of the public health sector is a frustrating challenge, and the formal establishment of the Office of Medical Staff Development within the Ministry of Health will mean for every Bahamian improved and reproducible quality of care, along with more equitable distribution of physicians across the archipelago. We intend to increase the number of family medicine physicians being trained, to increase the number from 57 to the required 120. As relates to management and labor relations, my ministry strives to maintain its amicable relationship with 3 trade unions representing its healthcare workforce. That's the BDU, the Bahamas Doctors Union, the Nurses Union, and the Bahamas Public Service Union. The PHA is presently in its final stages of negotiation with a 4th entity, the newly established Consultant Physician Staff Association, which is the bargaining unit for the physician consultants. Now, Mr. Speaker, I'm sure that there are members here that want to know what our priorities are. Except for the new Abaco and Exuma facilities, every one of the other 20 polyclinics constructed by the NIB board over the last 30 years, as well as facilities constructed by the government, are in need of repairs, redesign, or expansion. 45% of these 82 public health care clinics under the management of the Ministry of Health requires urgent repairs now. The challenge for the Ministry of Health is that the National Insurance Health Fund has been depleted, so we can no longer rely on these funds to effect the necessary repairs. So that means that we have to do several things. One, we need to meet with communities to determine which of the satellite clinics can be closed. Mr. Speaker, of the level 2 clinics around the country, data shows that only 2,600, or less than 1% of our people, are visiting these facilities today. And most of these are within close proximity to a polyclinic. If we then, having met with these communities to determine which of these satellite clinics should be closed so that we can consolidate resources, we can then use these resources to strengthen access to services with extended hours of operations at selected clinics in New Providence and the Family Islands, and ensure that all the main health centers, inclusive of those polyclinics, have the capacity to provide X-ray services, ultrasound, and lab tests. Now, in the 2019-2020 budget, My ministry will ensure that the following repairs are completed: in Acklands, Spring Point and Salina Point; in North Eleuthera, Spanish Wells and Harbor Island; back to Michael, near Guano. We will make a determination to see the ideal approach as to the renovations. In Mangrove Key and Nicholstown, we'll be seeking to identify alternative rental facilities as the clinic is repaired. We anticipate that by the end of June 2019, we will have started repairs on the old Governor's Harbor and Lower Bowl Clinic. We'll do minor repairs at the Massaquoi and Red Bays Clinic, minor repairs at the temporary clinic in Orange Creek, Flat Island, phase 1 of repairs at Deadman's Key and Sims. We'll do an assessment of the issues at the community clinic in Cockburn Town, and by the end of June 2019, the issues at the inaugural community clinic will also be addressed. By the end of June 2019, repairs at Foxtown and Cooperstown will be completed, and in New Providence, the scope of repairs at Anstown, Blue Hill Road, and Fleming Street will be determined. For the budget period 2019 to 2020, we will give focused attention to the following major capital works. The South Beach Health Center will undergo extensive repairs, redesign, and expansion.
Praise the Lord.
We will then create a one-stop shop to decompress the emergency room at Princess Margaret Hospital. And then we will provide urgent care services 7 days a week between the hours of 8 a.m. and midnight. This, Mr. Speaker, will be a first for residents in New Providence to have a primary health care clinic open 7 days a week. We will also do minor renovations and a reorganization of services at Elizabeth Estates. Mr. Speaker, the renovations at Coconut Grove Clinic, which started in March 2018, have stalled, as the magnitude of deficiencies was found to be far greater than expected. However, we anticipate that the work will recommence this month and will continue in the 2019-2020 budget. This facility was constructed in 1972 and is now 47 years old. And at the end of the repairs, it will be a site for the provision of specialist pediatric services. I move now to Governor's Harbor, Eleuthera. In May of 2017, the government began the process of construction of an advanced primary health care center in Palmetto Point, modeled on the facility in Marsh Harbor and Georgetown, Exuma. And the cost of this project was anticipated to be between $20 and $30 million. There was no identification of the source of funding. And on coming to office, my ministry undertook a review of the scope of the project and the services to provide it. We recognize that the cost to maintain Abaco and Exuma is more than $2.5 million per year. And the proposed model for Eleuthera was even bigger than those facilities. So, Mr. Speaker, we did not believe, and we do not now believe, that we have the fiscal ability to build a new $30 million mini hospital in Eleuthera. But what we do have the ability to do, following an assessment of Workers' House in Governor's Harbor by myself, the identified project architect, and other health officials from the Ministry of Health, we have concluded that retrofitting and renovation of that facility to create a mini clinic is indeed feasible, and we believe this can be done for less than $6 million. And so, Mr. Speaker, by December 2019, work to establish this advanced primary health care facility in Eleuthera will begin. Mr. Speaker, we have placed generators around the Commonwealth of the Bahamas, and as I get ready to wind down, I want to talk about the Public Hospital Authority, Public Hospitals Authority. The Public Hospitals Authority, or PHA, is responsible for the management of our nation's 3 public hospitals: PMH, RAN, and Sandlands, as well as the associated agencies, the National Emergency Medical Services, and the Supplies Management Agency. I am happy to report that the board and executive team of the PHA has articulated strategic directions and goals for the next 4 years. Our priorities are financial viability, clinical quality, and patient safety. The anticipated result of this strategic approach is to position the PHA for greater efficiencies. In the short, medium, and long term, the goals of the PHA are to augment revenue collections, streamline operations, and reduce waste. And a major objective of the authority over the next 5 years is to transition to a cost recovery model where dependence of the PHA on the public treasury is appropriately reduced. And in the interim, significant revenue augmentation initiatives, including real-time billing, revenue leakage reduction, centralized collections management, and strengthening of insurance claim processing are being undertaken. You will recall that the current 2018-2019 fiscal year, the PHA was allocated an operational budget of just under $216 million. 76% of that, or $163 million, is required to cover personal emoluments and allowances, leaving only $52.9 million for everything else. The proposed new budget for PHA is $223,455,000. Some of the issues that result in shortfalls in our budget include overtime, contracts for medical services like dialysis and radiation therapy. For example, the number of dialysis patients at PMH in Iran that had to be outsourced this year has been increasing annually, with a peak of approximately 253 patients currently being referred. This has cost us over $8.5 million, and expenditure to June 2019 is projected to be $8.8 million. With respect to revenue generation and collection, over the 2018-2019 period, the PHA's projected collection of $13.9 million is in line with the previous year's collection, but we are still $1.3 million below target. 86% of patients that access PHA do not pay for services. And of those that have been billed from 1988 to 2018, the Haymans have racked up unpaid bills at PMH of $782 million. The Haymans have racked up unpaid bills at PMH of $782 million. So I am obligated to say that if we are going to ensure equitable access to quality health care, we are going to have to stop this bleeding. And as such, we have introduced a coding program. We are hiring persons to manage an improved business office. And these individuals will populate a centralized billing and collections facility to collect the legally gazetted fees. Some, but not all of these fees will be adjusted to reflect current day costs. But we have not yet completed the recruitment exercise for leadership in this area. We have not yet agreed the final fee schedule. We do not yet have the private bed inventory to ramp up the adjustment of charges to ensure patients carrying insurance is paid for by the people of the Bahamas. But we shall begin applying the existing historic fee schedule effective immediately. So if we have persons who can pay, we ask them, pay the minimum that you are mandated to pay so that we can dramatically improve the services in our health system. But yes, we will adjust the fee schedule to be more reflective of current day costs. Right now, we are still not able to effectively bill and collect as we wish, but we expect to achieve this during this year. Now, Mr. Speaker, a major concern within our public hospital is limited bed capacity. All three public hospitals have a combined inpatient complement of 1,010 beds. And this is juxtaposed against the need to accommodate in excess of 21,000 admissions annually, totaling 271,000 annual patient days. This situation is felt most acutely by patients seeking care at PMH. And now, as part of a broader initiative to address the long-standing issue of chronic bed shortages, PMH, along with the other PHA institutions, have issued a tender for replacement hospital beds, medical, surgical, ICU, birthing, bariatric beds, pediatric beds, etc. It is expected that the short turnaround time for this tender, along with an expedited procurement process, will result in the new beds being installed within the hospital within a few short months. We have, however, gone on to complete renovations in at least one of the wards that had been taken out of commission as far back as 2016, and we shall continue our renovations on the male surgical wards, the children's wards, sometimes in cooperation with public-private partnerships. Mr. Speaker, in 2018, the authority initiated the Urgent and Emergency Care Project in collaboration with the Department of Public Health. This project will be the most expansive undertaking in public health since the construction of the critical care block in 2015. And the project is expected to reform access to urgent care and emergency care services in New Providence, upgrade and expand PMH's accident emergency department, while also upgrading the South Beach and Elizabeth Estates clinics, as I've mentioned. And these will serve as urgent care centers for emergency triage levels 3, 4, and 5. Construction documents for a revamped registration area within the emergency department, in addition to orthopedic services and wound care services, has been completed. We have recognized the great difficulty of innovation and transformation without access to funding. We have therefore benefited from and will continue to look for opportunities to craft beneficial public-private partnerships. This was done with the imaging upgrades, and has certainly been beneficial with the dialysis unit. Okay, Mr. Speaker, if I may, let me just... this is the recently upgraded dialysis unit at Princess Margaret Hospital. Done, this is the first phase with replacement of the chairs. We're about to get replacement of many of the dialysis machines. And ultimately, we're going to be introducing a brand new dialysis unit at Princess Margaret Hospital. Just a close-up of one of the new dialysis chairs, more comfortable for our patients. And then with public-private partnerships, Mr. Speaker, we have created brand new, we've put in brand new state-of-the-art CAT scanners at the Rand Memorial Hospital, as well as thoroughly redone and digitized the imaging capacity at Princess Margaret Hospital. So, Mr. Speaker, when I wrote this contribution, I was going to say that we have had no further problems with the chilling and air conditioning system in the critical care block at Princess Margaret Hospital, but I spoke too soon. 2 days ago, we had a serious challenge that may be reflective of sabotage. However, I am pleased to report that we should soon have definitive replacement of 2 of the major chillers, and it's expected that we will have no further challenges with the associated air conditioning systems in this building. I'd now like to spend a little bit of time with NHI. NHI was established in April of 2016 and was designed to achieve a shared goal of UHC, or universal health care, in the Bahamas. National health insurance was established with enrollment commencing April of 2017. Today, there are now 56,000 beneficiaries enrolled with this plan. Now, Mr. Speaker, this journey to implement universal health care has been ongoing in the Bahamas for more than 30 years, and we're still on this journey. I think it's important for us to understand, based on the premise of our discussion, that this administration is not prepared to take and bite off more than we can chew. And so while we remain committed to NHI, we will not make any decisions that will adversely impact the fiscal health of the people of the Bahamas. And so with those words, Mr. Speaker, I believe we've had a number of accomplishments. They include the recent upgrades to dialysis, the strength of our public-private partnerships is evidenced by the ambulance donations to the people of North Andros, the improvements in imaging at PMH. We've seen the extension of child health services to full hours of operation of South Beach Clinic. We have added family planning and gynae full-day access to the South Beach and Flamingo Gardens Clinic. We have seen digitization of radiology services, which facilitates telemedicine and improves access to diagnostic services at our hospitals and our community clinics. As we set about to improve our local health environment, I'm pleased to say that the Bahamas is making waves internationally. I was pleased to accept an appointment as president of the 56th Directing Council of the Pan-American Health Organization. Additionally, Professor Desiree Cox received the International Advocacy Award. Dr. Sharita Moxie was appointed as vice chair of the PAHO Strategic Planning Advisory Group. Dr. Giselle Alden, the top performing 2018 medical student graduate, and Dr. Nakia Forbes were honored as being top researchers with the most peer-reviewed articles. And as I conclude, Mr. Speaker, I think I've tried to show that the business of health is not for the faint of heart. But we remain committed to producing results that Bahamians can see, that they can feel, that they can touch, while also attending to those matters that go unnoticed and get no shine. The Bible says, be ye steadfast, unmovable, always abounding in the works for the Lord, because your labor will not be in vain. So as I take my seat, I want to thank the people of Elizabeth, with whom I could not be in this place. I want to thank my ministry. I want to thank the most honorable Prime Minister, who has allowed me to work for the people of the Bahamas in this capacity. And finally, I'd like to thank the Lord who gives me strength and wisdom to fight this good fight. Elizabeth supports this budget.
Thank you, Honorable Member Osmani. The Chair recognizes the Honorable Member for Fox Hill.
Thank you, Mr. Speaker. Mr. Speaker, today I am honored to stand before this House on behalf of the good people of the great constituency of Fox Hill to present my contribution to this 2019-2020 budget. Before I begin my contribution, Mr. Speaker, I would like to acknowledge and send congratulations to the new graduates of Doris Johnson Senior High School, Catherine International Academy, and Sandlands Primary School. I am happy to be able to report that we were able to present laptop computers to all of the valedictorians. Doris Johnson, as a matter of fact, had co-valedictorians, a young man and a young lady, and they could not make a distinction between the two. So congratulations to them. These young people will now be embarking on the next phase of their education. Congratulations also go out to the many people from Foxville who have graduated from the University of the Bahamas and universities and colleges abroad. And I say, well done. You're going to shape our country and indeed our world. I also extend congratulations to Bishop J. Carl Rami, who celebrated his 37th anniversary as the pastor of St. Paul's Baptist Church. That's the father of the member for Pinewood. And to Reverend Hardman Nixon, who celebrated his 7th pastoral anniversary at Macedonia Baptist Church, and Bishop Daniel Hall, who celebrated his 3rd pastoral anniversary at Bernard Road Baptist Church. Mr. Speaker, as I deliver my contribution to this budget, I believe that in unity there is strength. That when there is teamwork and collaboration, then wonderful things and life-enriching things can be achieved. That believers are never told to become one. We know that we already are one, and we are expected to act like it. I believe that if we are fighting each other, then we are distracted from the efforts to uplift our people. I believe that alone we can do very little, but together we can do great things, even things that seem impossible. And to club this, Mr. Speaker, so that everyone to the length and breadth of this country will understand. I know that the Golden Girls of the 4x1 relay team and the Golden Knights of the 4x4 relay team could never have brought home Olympic gold if they did not know how to make adjustments, if they did not know how to make allowances. Not turn a blind eye, make allowances, and how to turn their differences into their strengths to ensure that they did not drop the baton before they crossed the finish line victorious. Mr. Speaker, as I consider this 2019-2020 budget, it definitely does not have the buzz of excitement of the 2018-2019 budget that grabbed and held the national attention of the Bahamas for 2 whole weeks, and probably send the ratings of every talk show through the roof. The 2018-2019 budget, Mr. Speaker, was meant to be the start of the transformation of a country that had labored through 5 years of economic, social, and environmental difficulties. The population lived in dread of the next news item that would announce another downgrade, and the talk was rampant about a possible devaluation of the dollar. Isn't that funny that you don't hear that anymore? I wonder why. So much seems to be wrong, and one couldn't go anywhere without the state of the country being the #1 topic of conversation. Matters were indeed drear, and a pent-up population waited to exhale. And Mr. Speaker, the population did exhale with the huge We March Teletron that marched from Rosen Square, from our Key to Rosen Square, with a huge I don't care who sees me attitude. The resounding result is that the government changed. Basically, the people said to the Christie administration, be gone. And they said to the administration, fix it. And so I believe that the 2018-2019 budget was designed to fix the economic, social, and environmental problems that plague our beloved Bahamaland. And so I voted for that budget. I approve that budget. It is almost as though the directive to fix it meant fix it, but don't let it hurt. Fix it, but I don't want it to inconvenience me. Fix it, but I don't want it to cause any discomfort. I don't want. Mr. Speaker, the 2018-2019 budget seems to have at its core the paradigm shift. It was the foundational budget that was aimed at paving a road that would nudge or even shove the country into fiscal responsibility that would usher in new heights of entrepreneurial activities and lead Bahamians to economic independence and business ownership. It was a budget designed to enable the government to generate more revenue, reduce the need to borrow, and make funds available for capital work. Also encased in that budget was a regimen of fiscal behavior aimed at making the country compliant with certain crucial and critical international regulatory agencies. It was a budget for the people. It wasn't a budget of instant gratification. It was a budget of strong medicine, but with deductions and tax breaks to soften the rough road. But still I ask myself, did we miss in setting the right balance with the budget, Mr. Speaker? Did we lean too far in one direction and not far enough in the other direction? What is that magic formula to fix it and still keep everyone happy? What is just the right blend for everyone to feel, yes, this is not an easy road, but we will travel it with you because we know that there is better at the end. Yes, we will climb this mountain with you because we know that over the hill, through the valley, around the bend in the road, we will come to the green pasture of prosperity and quality living. We will come to a place that is a better country for all of us. But it might take a while. So what did we get as a result of the painful 2018-2019 budget? We got a Fiscal Responsibility Act that provides a legal framework for responsible fiscal management, a promise made, a promise kept. The practice of proper budgeting for known budgeting commitments to avoid the buildup of unpaid arrears was introduced. A promise made, a promise kept. A provision was made for clearing up old bills totaling some $360 million. A promise made, a promise kept. And 4, a multi-year fiscal responsible plan was established. A promise made, a promise kept. And so this budget, Mr. Speaker, this 2019-2020 budget reflects those 4 critically important achievements. It is the budget that tells people and tells the populace that we have reached a place some ways down the proverbial road to a better economic, social, and environmentally strong country. This budget is saying to you, please, stay the course. You've seen that glimmer of light emanating from the end of the tunnel. Please, stay the course, because we have overcome some of the perils that threaten our tranquility and our way of life. And even though we have not crested the mountaintop, the air was becoming cleaner and lighter, and the sun shone just a little bit bright. And so, Mr. Speaker, measures in place to fix it, not easy. not popular in many quarters. But the alternative, the alternative is something we do not ever want to see again in our lifetime. Mr. Speaker, my prayer and my belief is that the gains resulting from the record-breaking performance in the tourism sector will be the spark that will fuel sustainable growth in other sectors of our economy. Mr. Speaker, without a doubt, I am hitching my wagon to an economy, a society, and an environment that has an enticing place for my niece Amber, who is 2 years away from graduating from Middle Tennessee State University. I don't think it was, if I didn't think it was good for Amber, I would not think it was good for your university graduate. Mr. Speaker, without a doubt, I am hitching my wagon to an economy, a society, and an environment that has a plan for my friend, 105-year-old Mrs. Gwendolyn Clark of Foxville. And the contribution of the Minister of Social Services last night assures me that there is a plan. Mr. Speaker, without a doubt, I am hitching my wagon to an economy, a society, and an environment that has a plan for my 17-year-old cousin, Shanika Barnaby, who graduated from Doris Johnson Senior High School yesterday. And my 3-year-old cousin, who can go to school from age 2. The Minister of Education assures me that there's a plan of free education from age 2 to 22. If it's good enough for my family, I would not recommend it for your children. Good enough for us, and so it's good enough for all of us. Mr. Speaker, these people, the hundreds of thousands of Bahamians just like them, across the length and breadth of our Commonwealth, who we work for, whom we plan for, and for whom this budget is a foundation. The 2019-2020 budget is the rock on which we build our economy. The 2019-2020 budget is the rock on which we stand because, Mr. Speaker, all other ground is sinking sand. Mr. Speaker, this 2019-2020 budget has been characterized as one geared towards special interest. Mr. Speaker, I endorse that characterization. I do so, sir, because Bahamian people are special and deserve that special interest be shown towards their well-being and their future. I would like to see that the 2020-2021 budget be geared even more towards special interests of Bahamians. I would like to see more Bahamians in larger numbers at every level of multinational corporations domiciled in the Bahamas. I am glad that this government's special interest is committed to extending to Bahamians the same proportional concessions that are extended to foreign direct investors. I am glad that this budget has embedded in it a special interest by providing free education for Bahamians, again, age 2 to 22. That indeed is special interest. Mr. Speaker, for the first time, Bahamians can follow the budget on their smartphone or on their computer. This is a first, and it is special. It is bringing the business of government to the people just where they are. Mr. Speaker, in supporting this budget, I can assure you that I am not singing for my supper. As you listen to the roll call from the attendance register, my name is called number 35 of 35, so I am not singing for my supper. I can assure you further that there is no boot licking or butt kissing over here either. I support this budget because I believe it is moving in the right direction. Even though the Department of Social Services has budgetary increases in a number of key line items, thank you, God, such as such as foster care program, uniform assistance, food assistance program, subsistence support of persons, contracts of circumstances and emergency relief, death, assistance. Southern Shores, I would have lobbied for even more funding of this essential area, which supplies citizen support and a safety net during these times that are still tough economically for thousands of Bahamians. If I had my way, I don't see St. Anne. If I had my way, I would have agitated for a larger budget for international travel and subsistence in the Ministry of Financial Services, Trade and Industry and Immigration. Because I believe that a road team should travel at least 10 months out of the year seeking foreign direct investment so that we might be out of our economic woes even quicker and lower our unemployment numbers in a shorter and less painful way. And Mr. Speaker, I certainly would have expressed opposition to the $26.9 million cut in the capital expenditure budget of the Ministry of Works, because I've got plenty things to do in Foxborough. But on balance, I believe that this budget is fundamentally sound, moving in the right direction. It is not sexy. It is not filled with the drama that supplies newspapers and talk shows with attention-grabbing headlines and stories, like the last year's increase in value-added tax and the dramatic position of some of my colleagues who felt that they could not support the increase in that. I support this budget for many reasons, but some of the compelling ones are the promotion of an increased allocation from $5 million to $8.5 million to the small business sector. I am pleased that to date, over 3,500 small businesses have registered with the Small Business Development Center. That's 3,500 small men and small women. So there is a budget for the small man and the small woman. I am delighted that 13 small businesses have received funding and are out of the gates. I am pleased that the Ministry of Agriculture and Marine Science is training over 30 persons to become divers and thus lessen our reliance on foreign divers. And there is a steady commitment of ease of doing business. The Ministry of National Security is making inroads in their responsibility to maintain a safe society. I am pleased that the Water and Sewage Corporation is ensuring communities throughout our archipelago have clean, safe running and drinking water. So, without having to lick, to kiss, or sing, I have reasons to support this budget. Mr. Speaker, another reason I support this 2019-2020 budget is that it provides a means for me to continue infrastructure and other benefits work for the Foxborough constituency. People want to own their own home. It's the Bahamian dream. Mr. Speaker, the access to affordable housing in a different kind of way with service lots is the hallmark of this administration. Mr. Speaker, the member from Marco City, and I don't have his gift of gab, told the tale of how he and his family moved from rented house to rented house to rented house 7 times during his formative years. He spoke of his family moving from one corner to the next corner, from Angleston to what is now St. Barnabas, to Yellow Elder, to Foxborough, anywhere his mother could find affordable rental houses. They did not have the means to own a house. Mr. Speaker, $850 a month over a 10-year period for a family of 4 is $102,000. And with absolutely no equity in the house at the end of the day. The Lionel Davis Estate on Roma Street, Foxville, and Sunset Close, Southern Shores, and a housing estate in Carmichael makes owning your home a reality for Bahamians who may never have. And we can say thank you to this administration. We can say thank you to our leader, the member for Kalani. We can say thank you to the member for Marathon. Not just the other people can say thank you. We're saying thank you for real things that we can feel, we can touch, and we know benefits everybody. Mr. Speaker, these service lots, another promise made, promise kept. Mr. Speaker, there's no doubt that housing is an imperative. And with housing, we get new roads, new infrastructure. That is what makes a city. That is what makes a village. And so, I want to say thank you to the Minister of National Security. I'm looking for, and I don't know where it is in this budget, but I certainly am looking for it, my divisional police station in Foxville. Thank you for the shot spotter technology system that has been installed in several locations in the Foxville constituency. This revolutionary crime fighting strategy is a first for us. The system detects gunshots at the exact location and alerts law enforcement agencies in real time within 30 to 40 seconds. So thank you. The Bahamas is on its way to the safe country that we know it to be and that we want it to be. Mr. Speaker, I want to talk a little bit now about the Foxville Cemetery. There's a cemetery in Foxville and Foxville Road. Been there all my life. So it's been there a long time. And I haven't had 15 years of this job yet, Mr. Speaker, but something has to be done for this cemetery where many people have their last resting place in Foxville. So in this budget cycle, we will beautify and upgrade the Foxville Cemetery. Benches under the shady Poinciana trees. I've talked to Long Island, and we are looking into having a water fountain. I've talked to the member for the Central Grand Bahama, and we're talking about a special type of garden. And so, Mr. Speaker, this is what we call special interest. And we don't need what we call a caretaker to do this. We have an MP to do this. An MP who will do it during her time, and so at the end of the day, she's not walking away and saying, I shoulda, coulda, woulda. Mr. Speaker, I want to turn my attention a little bit now to something a bit different. And it's not exactly in a budget, but it makes a difference to our economy. I want to turn my attention to women issues. In March of this year, we celebrated International Women's Day. And Mr. Speaker, there were some interesting women in the Bible. that did things during their time that we haven't been able to do during our time. And so 37 years ago, we celebrated Janet Bostwick. And we have to make it possible for women not just to write the stories, but to be the story. Hard unemployment times hit women more than men because the woman really is the one who runs the house. Mr. Speaker, many of us in here came from single family homes where our mothers did a yeoman's job. Yes. She was the mother, she was the father, she was the breadwinner, she was the encourager, she was everything. And I say again, Mr. Speaker, I can't remember any woman that really started a major war anywhere in this world. And so, the budget, and so the budget needs to speak in certain ways to women, because they are the ones that basically have the lower paying jobs. Those are the ones that are laid off first. Those are the ones that continue to try to find a way. Yes. Those are the ones that get the very small amount for child care at our courts. Yeah. This is the time for us women and our colleagues, you men, to stand together and ensure that come 2022, some of the guys are going to say, I've run my race, I've finished my journey, I have a place for this female of the species. Yeah. I'm waiting for someone on the desk, Mr. Speaker. Mr. Speaker, I'm also happy, and this affects women too especially, that Marco's Law is on the way. Mount Moriah has said that there is a pilot out, and sometime this year, the full package should be rolled out. Often you see on WhatsApp some woman asking, or some mother asking, have you seen my daughter? Have you seen my child? This has been a long time in coming. And we've put some things that applies to today's world. WhatsApp, the technology. And so I wait with bated breath and with great expectation for when Marco's role will be rolled out. Mr. Speaker, I also believe that the Marco's Law, thank you. Mr. Speaker, I also believe that Marco's Law would be helpful to females as their parents become older, there's dementia, there's Alzheimer's, and parents go missing, not just children. And so Marco's Law, I am suggesting, can be expanded to help the elderly among us. The theme for International Women's Day 2019 was Think Equal, Build Smart, and Innovate for Change. Mr. Speaker, I went to university because of something the U.S. passed called Title IX. In 1972, there were just 30,000 women participating in NCAA sports as opposed to 170,000 men. After Title X, the numbers increased from 295,000 in 1972 to more than 2.6 million in 2006. If Title X can do this for girls, then Title X, or we can call it something else, can do it for girls and women in Bahamas. Mr. Speaker, it's fair to say that our biggest success on the international stage has been with our female athletes, not taking anything away from our men. And so, Mr. Speaker, with 60-some% of the population, we can work our way to more equity. It might be a little bit uncomfortable, Mr. Speaker, but it's democracy and it's growth and it's maturity at work. Mr. Speaker, I will turn my attention now to a few things in Foxville. We started the Bernard Road works in the last budget cycle. We still have some things to go. Our drainage is not yet completed, and I'm sure that Carmichael will deal with that in this budget cycle. Children walk to school in Foxville. People walk to church in Foxville. If you're walking along Bernard Road, anywhere just east of St. Augustine, just in front of Church of God of Prophecy to the west, around Freedom Park, and all the way to Davis Street. This is a floodplain during moderate and heavy downpour. And so I look forward to the completion of our road work in 2019-2020. Mr. Speaker, I'm also looking forward to more lighting because, as I say, this is a walking community and street lighting is important. Mr. Speaker, in terms of the drainage, the Ministry of Works was kind enough to give me not one, but 2 engineers. And they walked every street, every back road in Foxville with me. And so the plan that they put forward for Bernard Road and the surrounding areas included everything. Don't mind the noise in the marketplace to say they forgot about the well. The engineers at the Ministry of Works forgot about nothing. So, if you didn't do it, the time has passed, somebody else is doing it, leave it alone, get on with your life. Mr. Speaker, with St. Anne's, we've constructed a sidewalk that goes from the northern side of Step Street all the way up to St. Anne's School. For years, the children had to take their chances with the traffic. In a short 2 years, we've got sidewalks going up to St. Anne's School. Pedestrian crossing in the front of Montclair Union Baptist Church. I go to church there sometime when I visit, and Mr. Speaker, you should see me running across the street in my high-heeled shoes. Pedestrian crossing in the front of Church of God, Bernard Road. That's another very dangerous place, and we hope to see that in very short order. I'm also looking, Mount Moriah, for a change in police presence when school is done and when school begins. I'm looking to see where in the school zone the traffic flows to 15 miles per hour until they're out of the school zone. Mr. Speaker, as I said, Foxville is a walking community, and every day scores of children from L.W. Young on their way home from school stop at my constituency office for water. I think we go through several 5-gallon bottles a week. Hot time for them. So we make it a friendly place for children. Mr. Speaker, we don't think it's going to happen in this budget, but I just want to make a reminder to Lonnie that good things are happening in Bainstown and Grantstown, and Foxville is one of those places that is the cradle of our heritage, the cradle of our culture. It has been neglected for many years. It needs to look as good as Bain and Grantstown. It is a shining example of who we are, where we come from. And in that vein, I'd like to thank Seabreeze from her Prime Minister's Cultural Grant, which has been increased for donating to Foxville. It will be Foxville Festival. It will be put to good use. So, Mr. Speaker, to the teachers of Sandlands Primary School, we have now got 2 classes. Kind words, I would say this. They're working for you. They're trying to get you reelected. Overflow. We now have preschool at Sandlands Primary School, and we're looking for, and this is something that I'm sure St. Anne's, Yamakura, and Seabreeze would probably be interested in. A track at Doris Johnson High School. Doris Johnson High School has done exceptionally well this year. The basketball team has won just about every championship that you can think of, except 1 3/4. Just that one. That was an off day. And so I am pleased to announce that Royal Caribbean has agreed to take the boys aboard their ship when it's in the harbor on the 18th. We must always encourage our children. We must always let them know that from good work, there are good results and good reward. Mr. Speaker, I support this budget. I support this budget wholeheartedly. I don't say it's a perfect budget, but it's the budget that's going to take us where we need to go, where this country needs to go. And Foxville is there, 110%. Thank you.
Thank you, Honorable Member. As many? The chair recognizes the Honorable Member for West Grand Bahama and Bimini.
Thank you. Thank you. Mr. Speaker, every opportunity I receive to rise in this honorable House, backed by thousands whom I represent, I consider it a privilege. I speak for a constituency and the people who continue to believe in this nation and are standing tall with the mindset that if we are to see positive growth and development, we are the ones that must take the necessary steps to make it happen in tandem with our nation leaders. As a community, our heavy reliance on the government can take us only so far in our overall lives. As a country, our major dependency on other nations can last only so long. Mr. Speaker, West Grand Bahama and Bimini is of the view that the change needed to move this country forward is not to the north, south, east, or west, but above and right in front of us. The change, Mr. Speaker, is here on our shores, in our schools,
in our homes and on our jobs. Mr. Speaker, the everyday Bahamian, the one that labors, the one that buys goods and services, the one that creates, the one that builds. These are the people who will determine whether this nation of ours grows positively or diminishes quickly. Blue-collar workers is the term given. Grassroots is another. No matter the description, Mr. Speaker, they are the backbone of this country, and their needs are becoming greater and their voices louder. We owe it to each and every one of them to hear their cries and to govern right, even if it means that we are to be the sacrifice in order that our children may reap the rewards. Mr. Speaker, the time is now for us all, leaders and citizens, to strengthen our efforts in achieving a better Bahamas by ensuring patriotism over politics and compassion over controversy. West Grand Bahama and Bimini has no hesitation in supporting the 2019-2020 budget as communicated by Deputy Prime Minister and Minister of Finance, the Honorable K. Peter Turnquist. We support this government's efforts to ensure fiscal responsibility, and we welcome the strategy in achieving such. We are satisfied with the decision to offer everyday Bahamians through financial prudence the ability to secure services and benefits that will assist with daily living. West Grand Bahama and Bimini believes that when it is all said and done, this budget will be referred to as one in which the great turnaround for our Bahamaland started. Mr. Speaker, we are indeed grateful for a free national movement government, still the people's choice. West Grand Bahama and Bimini knows it. Bahamians are aware of it, and the opposition, no matter how hard they try, can't deny that this very same country, which experienced significant challenges with its fiscal management and governance just 2 years ago, is now headed in the right direction. I am of the view, Mr. Speaker, that publicly the members of the opposite rant and rave, but privately they are rejoicing. Mr. Speaker, the 2019-2020 budget, no doubt, is the beginning to an end of mismanagement of the people's money. As previously communicated, this very same budget will assist with entrepreneurial training, advanced education. It will improve the ease of doing business while supporting and making available capital for micro, small, and medium-sized enterprises. This budget is something that every citizen of this country who has been closely monitoring its governance since 2017 should be proud of. Mr. Speaker, West Grand Bahama and Bimini does not subscribe to what is being said about this administration placing numbers over people. We are not about numbers, but rather utilizing figures to ensure a prosperous and profitable future. Mr. Speaker, we are unable to show you the money unless we show you the numbers. It's called transparency and accountability. Tourism is better with historic visitor arrivals. Agriculture and fisheries is expanding like never before. Government finances are better managed and the deficit is down. Bills are being paid to those who provided services and were left holding the bag by a government that failed to meet its obligations. Education is better, and school children are being equipped with the latest in technology and higher learning at very little or no cost at all. Better health care is on the rise with major upgrades to facilities and services throughout this nation like never before. Infrastructural developments are taking place consistently, and the power supply is receiving long-awaited attention. Crime is down and people are feeling safer. Social benefits are more. However, many are deciding to empower themselves instead. Investors are knocking on our doors with a newfound trust in this country's governance. The list, Mr. Speaker, can go on, but I think it suffice to say that as we move to the future, we are headed in the right direction. We must stay the course. Mr. Speaker, West Grand Bahama and Bimini continues to thank God for his many blessings. We are appreciative of this government's efforts in building a better country. We believe in the leadership of Prime Minister, the Most Honorable Dr. Hubert Minnis and his cabinet, and we are eager to contribute to the overall success of this nation. Mr. Speaker, as the Parliamentary Secretary in the Office of the Prime Minister, with responsibility for information and communications and that of land and surveys, I must admit that notwithstanding successes in some areas, we are just now touching the surface, and there remains major work to be done in both of these areas. Are the teams up to the task? I am happy to say, Mr. Speaker, that they are, and I believe that as a result of work now underway, we will achieve goals set by this government in the assigned sectors. I turn my attention to land and surveys, Mr. Speaker. No man is an island, and if we are to see a better country, it will take every community to do its part. For a long time, Mr. Speaker, our very own citizens have felt as though they are second in their country. The tide, however, is shifting, and one such area in which we will demonstrate our commitment to securing the best possible future for our citizens, including our youth, is by ensuring land ownership. Land, capital, and infrastructure are three areas that contribute to the wealth of an individual and a community. And I can assure you, Mr. Speaker, that the cries of Bahamians in this area have not fallen on deaf ears. Currently at the Land and Survey Department is a team dedicated to carrying out this government's mandate, which calls for land reform. Land and Surveys, Mr. Speaker, is transitioning into a modernized entity capable of correcting the challenges of the past while accommodating customers by effectively managing the demands of the future. I wish to state, Mr. Speaker, that the long-standing issue of having a backlog of land applications will be no more. As we press into the digital era, major renovations are about to come on stream at our current location, and the implementation of a website for our matters related to land and survey just as well. Our team aims to provide better customer service, but most importantly, ensure that Bahamians become the primary owners of this wealth called the Commonwealth of the Bahamas. Mr. Speaker, the Member for Karani and Minister for Land and Surveys, Prime Minister, the Most Honorable Dr. Hubert Minnis, in his communication will outline specific plans regarding land in this country. It is something, Mr. Speaker, which West Grand Bahama and Bimini believes Bahamians from Managua in the south to Abaco in the north will welcome with open arms. Mr. Speaker, the issue of land has caused much tension in this country, and under this F&M administration, our goal is to simply ensure that in its distribution, right is done by and for all, Mr. Speaker. I turn my attention to the Bahamas Telecommunications Company. BTC is in the process of winning back its loyal customers and continue to upgrade and develop its infrastructure to meet the demands of its valuable clients. Over the past few years, BTC has been challenged with the introduction of a new competitor within the telecommunications market. As with the introduction of new entrants within this space, incumbent operators usually lose market share, and in the case of BTC, we have been challenged with such existence, particularly in the provision of mobile services. Mr. Speaker, BTC, however, is bouncing back and has seen improvement in its service provisioning to its valuable customers. BTC is seeking to train and retrain its staff to properly equip them for the high demands being initiated by customers at this time. Training programs are ongoing for both BTC employees and its partners. Upgrades and installation of new equipment to accommodate high data speeds are currently taking place. The introduction of fiber to the home is being realized and has now been installed within the eastern end of the island of New Providence. And now, Mr. Speaker, focus is on the central area of New Providence and will continue until the entire island is upgraded. And might I add, Mr. Speaker, the same can be said of West Grand Bahama, having been the first community to undergo such in the nation's second city. Mr. Speaker, It is the intent of BTC to provide fiber to the home to all households, totally retiring copper underground and overhead cable connections. Our mean times for installation and repairs has been reduced tremendously, with the goal moving forward being to reduce times for installation and repairs within 24 to 48 hours. Mr. Speaker, projected development plans for BTC are as follows. New mobile sites to be constructed along with expansion of 29 existing cell sites within New Providence, Exuma, and Grand Bahama. Do expect these installations to be completed by the end of the year. We'll get to you. BTC, gotta start somewhere. BTC is upgrading its broadband capabilities with minimum maximum speeds of 25 megabytes to 75 at this moment. BTC is targeting the islands of New Providence, Exuma, Grand Bahama, Eleuthera, Long Island, Abaco, Rumkey, and San Salvador to provide these high-speed services. Flow TV improvements. Andres will get to you. Flow TV improvements have been realized and is presently equipped to accommodate hospitality TV suite for small and large hotels, and of course, Mr. Speaker, for the single and multiple dwelling homes. Target Islands are New Providence, Grand Bahama, Eleuthera, Long Island, Abaco, Rumkey, San Salvador, Cat Island, Bimini, Crooked Island, and Anagua. Voice network, Mr. Speaker, improvements are ongoing to upgrade fixed voice switching networks while retiring depreciated technologies. This is being done for the entire Bahamas. That's Andros included.
Thank you.
BTC has signed a 5-year contract with the Ministry of Education to provide fiber optic services to 127 schools throughout the Bahamas. Much focus will be done on improving and upgrading Family Island central offices and all of their transmission equipment. Mr. Speaker, BTC is seeking to improve its financial position by reducing its operational expenses versus its revenue to a reasonable percentage rate of under 50%. BTC has recently completed its negotiations with the Bahamas Communications and Public Officers Union and is now engaged with the Bahamas Communications Public Management Union to complete a contractual deal. It is hoped that negotiations for this deal will be completed very soon. Mr. Speaker, the Broadcasting Corporation of the Bahamas is committed to its mandate settled by this free national movement government to ensure that it becomes a public service broadcaster with news, information, and programming that is relevant to the well-being of our country and its people. The board and management continue their efforts to ensure that the staff and general public understand and are fully aware of the role that ZNS plays for this country, especially amidst rampant news and information in which fake news has taken on an identity of its own and citizen journalism in some instances irresponsibly carried out. Public service broadcasting, Mr. Speaker, will mean that the BCB will instead have to rely on the generous donations of foundations, businesses, and pledges from members of the public. And while government intervention can still take place, our reliance on funding from such will not be our primary source of revenue. Public service broadcasting, Mr. Speaker, will result in programs that are of a national interest, covering areas such as health, education, the arts, culture, commerce, just to name a few. Mr. Speaker, the corporation is engaged in shifting its organizational culture when nothing less than productivity and professionalism is demonstrated, while simultaneously strengthening its operational structure by expanding training and seeking new revenue initiatives. Mr. Speaker, the Broadcasting Corporation of the Bahamas continues to inform, educate, and entertain our citizens who are widespread and depend on our services to stay abreast of national issues. Today, Mr. Speaker, There remains no other news source in this country that covers the Bahamas better than ZNS. With this, Mr. Speaker, we believe that our national station should never be treated as an afterthought. But given the digital tools and human resources necessary to disseminate news and information instantaneously. Presently, Mr. Speaker, the corporation is putting in place additional initiatives to strengthen ZNS's programming on radio and television so as to satisfy its audience with new locally produced programs and a variety of quality international programs. Mr. Speaker, in 2012, the corporation's headquarters, based right here in New Providence, was upgraded to the digital format, and I noted in my first address in 2017 to this August body that we must turn our attention immediately to the upgrading of the Freeport office, Northern Service, to be on par with ZNS Nassau. Well, Mr. Speaker, I am happy to report that the board and management have done just that at a cost of some $575,000, and in short order, we will be launching the Northern Station to the digital television platform. Mr. Speaker, during the first and second quarters of this year, much of our attention at the BCB was turned to the improving the space and delivery of new equipment, also in the Northern Service office. While Bahamas' time has come, with these changes, the corporation will no longer have one foot in the digital world and the other in the analog sector. We will be fully digital in both entities of the Broadcasting Corporation of the Bahamas. Mr. Speaker, over the last several months, the board and management of the BCB experienced several outages due to electrical interruptions to its electrical system, which was installed more than 40-50 years ago when ZNS first began transmitting. Mr. Speaker, I am happy to report that at a cost of some $111,000, we have upgraded by replacing the outdated electrical system at headquarters, inclusive of a new 1200 AMPS, that's something in electrical term, right?
Yes.
Amps, they call it amps, Mr. Speaker. Main electrical service with an automatic transfer switch. I'm communications, I don't know if I'm electric. Transfer switch. Mr. Speaker, after years of wear and tear and hurricane damage, general repairs to the television building at headquarters are completed, and the repairs to the roof of the radio department continues, with an anticipated completion date before the end of the fourth quarter of this year. Mr. Speaker, the BCB's effort to become more self-reliant and financially prudent has led us to take a closer look at our expenditures and revenue, keeping in mind that we are to move in the direction which will result in a financially stable entity. Currently, there are several cost-cutting measures that management is reviewing in an effort to reduce its operating costs, such as the elimination of the satellite uplink Earth station, which carries a monthly cost of some $22,000 and is paid to a U.S.-based company. Mr. Speaker, our intent is to eliminate that hefty cost by utilizing a new and more innovative approach, engaging business right here at home. Mr. Speaker, on another note, Cable Bahamas, through non-contentious dialogue and a common goal of providing the best for viewers throughout this country, was asked in 2018 to ensure that all the family islands that were not receiving ZNS did. I am happy to report that all the outstanding family islands are now receiving ZNS as promised. Mr. Speaker, the updating of equipment has also been a focus of the past year, and as technology quickly changes, management will take measures to better the delivery of the product to the Bahamian people. The future for ZNS remains connecting the people of this nation, and technology continues to push the method by which we can. ZNS remains in the forefront of ensuring this and will strengthen its ambitions to continue with trailblazing initiatives. The year 2018-2019, Mr. Speaker, has been about expanding our programming and highlighting our varied stories. The 13 on TV 13 documentary series began in an effort to highlight the many contributions of the people of this country, and we will continue to make this a signature program on ZNS. For the first time in the history of broadcast of the BCB, the morning show Morning Edition was launched in 2018 with live coverage of current affairs and news. Mr. Speaker, we will continue with this effort to strengthen the AM television hours with additional programs geared at meeting the demands of our viewers. Mr. Speaker, through independent producers, we have attracted such programs as A Closer Look with veteran broadcaster Mr. Anthony Newbold, which highlights the ins and outs of government business from individuals at the helm of the various ministries. Mr. Speaker, these are just a few of a variety of new programs for both television and radio now being broadcast, and it's just the beginning. Mr. Speaker, as management increases its drive to bring additional revenue and highlight those other important stories, we are confident that it will be well-rounded, catering to every sector of the population, including the millennials and youth, with our new social media platform, which was revamped in late 2018. Mr. Speaker, in 2019, the board and management also intends to find beneficial ways to grow BCB's revenue with an increased online presence. Mr. Speaker, the BCB continues to be in direct competition with numerous radio and television stations in the Bahamas. Stations that are able can literally give away their inventory of airtime, as it is not their primary source of revenue generation. Despite this competition viewed as unfair, ZNS continues to hold its own with the competition for limited sales dollars. As a broadcast and communications institution, we are not growing as fast as we would like, as the subject of financial restrictions place great limitations on our ability to acquire quality local and international programming and technology of the day. Financially, we project revenues to year-end June 2019 in the region of $4.3 million. This compares unfavorably with revenues in 2017 of $5.4 million and 2018 of $4.7 million, a decrease of about 8.5%. It should be noted again that 2017 was an election year, which made for more revenue generation from various political parties. We at ZNS continue to strive to reduce overall expenses without sacrificing jobs or services to the public, a daunting task, but one we have accepted. Overall, we project expenses for 2019 year-end to top out at $13.4 million. It is the BCB's stated objective to reduce overall expenses by a minimum of 5% year-over-year, which we began in 2018, in line with our government's fiscal responsibility platform. However, as a state-owned entity, there are legacy concerns that must be resolved to assist management in furthering its fiscal balance and adhering to its outstanding obligations as an SOE. We recognize that these are difficult times, and this administration has had to make hard and serious choices. Despite these choices, Mr. Speaker, we will not sacrifice quality and will continue to strive to identify new and creative revenue streams and find ways to meaningfully introduce cost reduction wherever possible. Mr. Speaker, the use of new technology is forcing media professionals to reinvent and upgrade their skills and institutions to be competitive and relevant. The Broadcasting Corporation intends to provide the equipment and training to remain on the cutting edge and deliver on its mandate for all the people of the Bahamas. Mr. Speaker, the BCB has given birth to every television and radio station in this country and looks forward to reinventing itself in the coming months. It is now time for ZNS to be allowed to fulfill its principal role, and the Broadcasting Act must be amended to ensure that the professionals at ZNS work in the interest of the Bahamian people. We are calling on members of the Cabinet to assist us in this vein. No longer can the Act remain as is. ZNS needs to become a public service broadcaster in law. After all, it is the people's station. Turning our attention to Bahamas Information Services, Mr. Speaker. Over the past 2 years and under the leadership of this free national movement government, Bahamas Information Services has experienced a metamorphosis in its development and dissemination of government press releases, articles, captions, and notices, as well as audio-video content to the local press media agencies, and to members of the general public. BIS, under the leadership of its Director General, has successfully been transformed into a more efficient, productive, and robust multimedia agency within the government of the Bahamas. Mr. Speaker, let me use this opportunity to sensitize the nation that BIS, by an act of this very Parliament, is the official public relations agency and production facilities for the government of the Commonwealth of the Bahamas. And I am extremely proud of the hard work of the men and women who make up the creative and line staff of this entity. Mr. Speaker, I am pleased to share just a few of the new and exciting initiatives that have been successfully introduced and accomplished by Bahamas Information Services over the past 12 months. BIS has introduced a weekly television infomercial entitled BIS Update. This program, which is usually no more than 5 minutes in length, showcases key achievements of the government on a weekly basis. BIS Update is distributed to thousands via e-blast, showcased on various social media platforms, and is aired weekly on the ZNS television network. BIS has also introduced BIS Daily Radio Recap, which is a daily radio program that highlights and promotes what the government has achieved and accomplished on a daily basis. This program, which is no more than 90 seconds in length, is distributed daily to thousands of Bahamians, also via email blast, WhatsApp, social media, and is now currently heard on a number of private radio stations here in New Providence, and as well on some of our family of islands, including Anagua, Abaco, Grand Bahama, and several others. BIS has also taped, edited, and successfully distributed for airplay to various local television and radio stations of 3 of the national reports delivered by our Prime Minister, the Most Honorable Dr. Hubert Minnis, from January to May of this year. Some of the future projects in the pipeline at BIS include BIS Weekly, an electronic newsletter that features articles written by our team of talented information officers, as well as dynamic photographs captured by our team of professional photographers. BIS Weekly TV. This will be a weekly 30-minute television program designed to promote the major initiatives, projects, and accomplishments of this government. This program is scheduled to be aired weekly on ZNS TV 13. BIS is also in the process of rebranding and will host a major launch of its new look and design to the general public within the coming months. This as we push towards being housed in a new office space that will meet the demands of the job at hand. Mr. Speaker, we are extremely excited about the future of BIS as we continue in our pursuit to educate, inform, and enlighten the people of the Commonwealth of the Bahamas. Mr. Speaker, I now turn my attention to that of my constituency. This member is satisfied of what is transpiring in the constituency of West Grand Bahama and Bimini. While we are disappointed, Mr. Speaker, that we cannot report any major infrastructural developments today. Mr. Speaker, we are optimistic that this year's budget will be kind to us, having already appealed for much-needed seawalls in both Bimini and West End for starters. There remains, Mr. Speaker, a great need for our roads to be repaired and properly lit, particularly in West End, Grand Bahama, where many have lost their lives in traffic accidents. This alarm, Mr. Speaker, has been sounded year after year after year. The roads of West End in particular are just too dark. We need our streets to be properly lit. Furthermore, Mr. Speaker, due to a lack of maintenance of our roadsides, the root of trees such as casuarina pine continue to lift the surface, making it unbalanced and dangerous for motorists. Mr. Speaker, West Grand Bahama is the government's community, and it is in need of government attention. Mr. Speaker, the well-being of the elderly and youth of my area is something that I am passionate about, and thus my concern for these sectors. I must commend persons of the urban renewal offices in both Bimini and West Grand Bahama who have been doing an exceptional job and whom I have partnered with on numerous occasions to assist with programs catering to these individuals. My concern, however, Mr. Speaker, is that the youth of our area continues to be disenfranchised. We therefore appeal for a state-of-the-art multi-purpose center and sporting facility for both Bimini and West Grand Bahama. Our community continues to create world-class athletes with very little resources. Can you imagine what will come with this investment in our youth? The youth of West Grand Bahama and Bimini, Mr. Speaker, are calling for more focused attention from the government. Mr. Speaker, there is much work to be done. West Grand Bahama and Bimini does not wish to remain on the outside looking in. Having proven storm after storm, government after government, budget after budget, that we are a people who continue to hold our own. The strong, however, Mr. Speaker, can become weary and discouraged. Mr. Speaker, let me for a moment speak to the realities of my constituency and its people, whom I would not trade for the world. People people that I will fight for with every breath in my body as long as the good Lord allows me. My fight, Mr. Speaker, is not confined to this House. And whether I am in or out, my voice will speak. I'm only human, right? Confined to this House, and whether I am in or out, this voice will speak, and these hands will work for their benefit. Well, thank you. Mr. Speaker, let's begin with West Grand Bahama. The reality is successive governments have not done enough. To give us that push. I prefer my head today. To give us that push that we need to get over this hump that has plagued us for years. That hump, Mr. Speaker, is a lack of belief that we are able to make a difference in the economic stability of our island. Mr. Speaker, we are the mom and the pop stars. We are the laborers that cause for monies to be made in big business. We are the youth. Okay. We are the youth that work with barely nothing but capture international headlines. We are the forgotten ones. As you would have heard in this House from other Farm Island representatives, we are often overlooked, not because we can't, but because we are far away. Mr. Speaker, I love New Providence. It represents this country well, and I would not ask for any focus to be taken away. The reality is, however, that it's overpopulated, and what better way is there to assist in that depopulation other than giving those who run here for opportunities a reason to return to their homes? The Family Islands need more focus. It is time to bring them on stream. West Grand Bahama, Mr. Speaker, is the government's child, and we are in need of our parents' attention. I reiterate, Mr. Speaker, believe in us enough by providing us with seawalls, particularly in West End, having been hit hurricane after hurricane. Believe in us enough to reconstruct our government dock in order to bring further economic activity. Believe in us enough to pave our roads, none of which is just a straight highway. Believe in us enough to establish a major multi-purpose youth and sporting facility so our children may sharpen their skills and talents. Believe in us enough to delay no further unnecessary action. This is all we ask at the moment, Mr. Speaker. We will do the rest. Mr. Speaker, please don't get me wrong. I am pleased to report that in spite of it all, this member, along with a group of hard-working individuals, consisting of those in our constituency, urban renewal, the administrator and local government officers, the schools of both West Grand Bahama and Bimini are making significant strides in meeting the needs of the people of our area. We are about the people's business, and while we continue to urge the powers that be of the various ministries to help by doing their part in helping build our area, we will push forward, realizing that what is done with little is done with much. I therefore report, Mr. Speaker, that during the year 2018-2019, we have done as much as we could on the ground. We witnessed some 50-plus individuals graduate from the Bahama Host Program in West Grand Bahama and more than 100 in Bimini. We introduced for the first time in partnership with UNEXO the open water diving certification course for individuals ages 18 to 50, with the first class having successfully completed the course. This, Mr. Speaker, we are proud to say, came prior to Agriculture and Fisheries launching their initiative, which we will certainly encourage our constituents to now take advantage of. I therefore call on all those interested in this type program to visit the National Training Agency to make applications to the program as mentioned by Minister Michael Pintard. In West Grand Bahama, Mr. Speaker, we are thankful for work which continues to be carried out at the administrative complex in Pinedale, 8 Mile Rep, and the junior high school in Holmes Rep. We look forward to the earliest completion of both, as our community remains hopeful of the job opportunities that will come as a result. We are also happy to report that the completion of the administrative complex, which will house the various government departments in Bimini, is scheduled for November of this year, as we also eye renovations to the current building, which houses the administrator for the island and police. On that note, Mr. Speaker, I wish to point out that after years and years of calling for World Traffic Office in Bimini, work is currently being carried out for this department, with completion expected in just a matter of weeks. This means, Mr. Speaker, that persons from Bimini will no longer have to travel to Nassau or Freeport and pay hundreds of dollars just to get their license, which costs less. Knowing the importance of a clean environment and its impact on the economy, Mr. Speaker, I am happy to report that the makeshift West End dump site, which plagued residents and visitors alike in approaching that community, has been cleaned up after years of being allowed to build. We are thankful to the partnership of the Ministry of Grand Bahama and Environmental Health, Mr. Speaker, in this initiative. Mr. Speaker, I am happy to report that through our License to Succeed program within the past year alone, we have assisted 70-plus persons in ensuring that they are legitimately conducting business by taking them through the necessary steps to receive their business license. Of that number, Mr. Speaker, some 95% are home-based businesses. Mr. Speaker, the West Grand Bahama and Bimini constituency is that train that keeps chugging away. And while we realize that the funds are just not there as we wish in order that we may receive more, we are optimistic of the strength we are gaining. Slowly but surely, with Bimini leading the way, particularly in the tourism sector, we must take our hats off, Mr. Speaker, to the Minister of Tourism and his team for the work they are doing. The arrival of Virgin Cruises is in April of 2020, bringing with it 2,700 passengers as it docks 3 times every 2 weeks, which will amount to some 78 stops per year. Undoubtedly, there will be jobs created. Resorts World Bimini, for starters, is building a beach club to cater to passengers. These passengers, however, will not be limited to just that property and will also wish to take in the sights and sounds of Bimini in its entirety. I therefore appeal to Biminites firstly, but Bahamians in general, to take advantage of empowerment opportunities by creating tours and excursions and experiences in general that will wow the visitors and bring economic stability for themselves. This investment into Bimini's economy, Mr. Speaker, will mean some 200,000 passengers annually to the island. Mr. Speaker, we are going to need more space. Mr. Speaker, we continue to do much in both West Grand Bahama and Bimini. I am happy to say that we are currently working with the Administrator Local Government Office and the newly established or re-established Bimini Sports Council, where we are going to be catering to our youth of the area, and repairs have already begun at the baseball field. As you know, Mr. Speaker, there's no baseball like Bimini baseball. Mr. Speaker.
My cousin.
Mr. Speaker, one of our most significant accomplishments, Mr. Speaker, we are proud of all that our schools are doing in West Grand Bahama and Bimini, and we take our hats off to all of the education officials that continue to look out for the best interest of our students. One of our most significant accomplishments that we wish to recognize, Mr. Speaker, comes from the District of Bimini at the Louise McDonald High School. Under the leadership of Principal Demetrius Wagons and a group of hard-working teachers, the 2018-2019 academic year began with the school celebrating an increase in academic achievement from the previous year. Mr. Speaker, the number of passes in the BJC exams at Louise McDonald High School was only at 28% in 2017. And that, Mr. Speaker, increased to 49% by 2018. Similarly, the the BGCSE results improved from 45% to 68%. Also during the same period, Mr. Speaker, students earning a 2.0 GPA and above increased from 55% to 73%. These achievements, Mr. Speaker, resulted in the Ministry of Education Examination and Assessment Division awarding the Louise McDonald High School the Minister's Award for Most Improved Performance in Government Schools in the 2018 BJC examination, Category B, in February of this year. Additionally, during the Christmas term 2018, 100% of the senior school, 10, 11, and 12th grade received GPAs of 2.0 and above. Mr. Speaker, Mr. Speaker, school officials are reporting that from their most recent progress reports, the results of this year will surpass last year's, and that the school is trending in the right direction. Mr. Speaker, I am indeed proud of the West Grand Bahama and Bimini constituency and proud of the people. Mr. Speaker, famed civil rights activist Malcolm X once said, if you have no critics, you'll likely have no success. Mr. Speaker, this F&M administration has had criticism lobbied against us from the start. Practically every move we have made thus far has been questioned, and we hear the criticisms loud and clear, but there is much to be achieved with steady hands and a focused mindset. Mr. Speaker, we have that in the form of this nation's leader, the Most Honorable Dr. Hubert Minnis and his cabinet. Steady we go in spite of it all, Mr. Speaker. We are being guided in the right direction. We won't stop. We can't stop. Join us now as we take this governance to another level. I thank God, my family, my constituents, my colleagues, especially my golden ministers, I call them, the various government agencies and my partners for all that has been done thus far to assist this member in her work for the people. Our work will not be in vain. West Grand Bahama and Bimini supports this budget.
Thank you, Honorable Member. As many? The Chair recognizes the Honorable Member for Cat Island, Rumkey, and San Salvador. When we return. Thank you, Honorable Member. The Chair recognizes the Honorable Member for Bamboo Town.
Thank you. Sorry about that, Mr. Speaker. The rules insisted we be a last one. Mr. Speaker, I do not move that the House suspends until 3 p.m. for the luncheon break. Speaker, I second that.
Honorable members, it has been moved and seconded that the business of this House suspends until 3 p.m. this afternoon. As many members are in favor, will remain seated. Those who oppose will stand. The business of this House stands suspended until 3 p.m. this afternoon.